I've come along completely prepared for today. As I was getting on the plane, my husband said to me, "Where's your PowerPoint?" I said, "I've got one slide, that'll do." He said, "What are you going to talk about?" I said, "No idea, I'm going to listen to the other speakers and get some ideas." So that's what I've done, because this is about you. It's not about me. It's about you out there, what you can do, what you think you can do, what you're now inspired to do. And it is going to be an interactive session. So I just want to pull out just a couple of points that I got from the other speakers. Then I'm going to turn it over to you, some butcher's papers and some fabulous coloured pencils. And I want you to spend a few minutes just in your tables. And I'd like you all to come down if you're at the back and join a table, because we've only got 8 tables and we've only got 8 pieces of butcher's paper, so that you can put some ideas down. And then what I will do, and I will undertake to do, is to collate those pieces of butcher's paper and get them put up, all those ideas, onto the APNA website, because I'm an APNA board member. I've just lost my little green thing. I must put it on the table. So, from Jenny and Paula, I got membership of your Medicare Local, if you are able to. Because I know that my Medicare Local does not encourage nurses, and they do not, any individual member doesn't have voting rights, only organisational voting rights. Investigate the membership of your Medicare Local. Number 1 thing to stick on your list when you get your butcher's paper. Check out the email newsletters. I can't imagine that there's a Medicare Local that doesn't have some form of communication that's coming out to health providers in some form. Get your name on the list, or if they just send you a note to say it's ready and you have to view it on their website, go and do that. Keep informed. Know what's happening in your area. Seize any opportunity that comes past to sit on committees. I think those were the 3 big things I took out of Jenny and Paula's presentation. There's an opportunity, seize it. That's the 3 things that go on the top. The next thing, I listened to Tracy, and what I got from that is quite a lot of things, really, not necessarily to do with this, but it's around leadership, and it's around a time to pursue development. And that's time to pursue development, not just in what's happening in healthcare, but what's happening in ourselves. And what's happening for us is that we've got this whole health reform where, for some of you, your Medicare Local has gone off on a tangent. I've actually rung a Medicare Local and been told, because I was trying to find someone who was my counterpart, we actually don't do any practice support anymore. And I just sat there going, oh, okay. Well, I know we don't do a lot because there's only me doing that stuff. But, I would have thought that was core business. Apparently, there are some differing views out there. So don't expect a Medicare Local in A to look like a Medicare Local in B. One will be a sheep, one will be a wolf, and you've probably got a giraffe out the back and possibly an elephant. So get to know your Medicare Local. What is their vision? What is their mission? Who's sitting on the board? They're people that are potential targets for you as a nurse if you're not getting what you want. I love the bit about unification and evaluation. They were lovely words. I'm not sure that I've got them in the context that Tracy gave them, but I think if you're not getting what you want, you need to step up to that leadership board, try and unify the girls in your area and come up with a proposal. And in fact, I just think Roz should be up here doing this session, not me, because that's the answer. If you're not getting what you want, go out and find it. And the final thing was, I thought, a very, very powerful statement from Roz. Commitment of a small number of nurses. I use the term primary healthcare nurses working in general practice, can engage a Medicare Local and beyond. And that's the challenge today, to find out what you think you can do. So I want you to just kind of spend about 2 minutes putting some thoughts into your head. And then I want you to start writing down some of those things that you think that you, on the ground, here today, can do to engage with your Medicare Local, particularly if they're not engaging with you. We're going to spend 5 minutes at that whole exercise because we're running out of time. Okay? You've got 1 minute to get some stuff on your butcher's paper, please. Okay, thank you everybody. Thank you. Even if you didn't get much on your butcher's paper, I hope you got something out of the discussion, because there was certainly a lot of discussion in the room. I'm just going to ask one person from each table just to stand up and give us one thing that you think that you can now go home and do if you're having issues, or one thing you would like to concentrate on. So we will start, obviously, right over there. Yes, yes, please. You can just stand up and speak loudly because we don't have a roving mic. We're actually all from Medicare Local. Yeah, so hang on. Thank you.
All of our table are Medicare Locals, except for one lady here who has a similar kind of role. I think what we sort of found, sorry, this lady is a Northern Territory Medicare Local. There's one office in the whole of Northern Territory. So, you know, it's amazing. They can't do practice support visits, it's impossible. So we were just looking at different Medicare Locals and how they respond to different needs in our areas.
Did you come up with anything that you thought would be applicable? Okay, if you're a practice nurse, I need to tell you that your Medicare Locals are floundering. They're struggling to engage with you, obviously. Yeah. I'm passed on, I know that's the table of Medicare Locals as well. Even worse, they're all from WA. Go on, Adele, get up and make noise.
Yeah, we actually know from Medicare Local as well, and we discussed about us giving practice and general practice nurses support. Coming from working in Division Land, we had 5 practice support nurses, and we've now got no practice support. So really, I think it's a programme coordinator. I think it's for us to go out to general practices. You know, we're busy enough, but I think we need to give them the support, let them know what we do, let them know the website and what we've got available, but there's no practice support, which is really quite sad.
Okay, can you pass on to this next table?
I think we just had a general discussion about how the Medicare Local is trying to match the population needs in our area, and whether, because of the new restructuring, they have spread themselves very broadly without going to colour so much. And it's also been good because it's explained to me how they work, and that there is a baseline service that they are expected to supply across Australia.
Actually, could you just pass it to anybody sitting in the back row, just one person, and I want that person to stand up and just give us something that has come out of this. Look, yes. You're amongst nurses, you're very, very at home.
The question is?
What have you got out of this? Is there something that you think you might be able to do now? That
Well, I
you
come
couldn't
from
before?
an area where there were 4 or 5 divisions joined together into one Medicare Local. There are no nurses now on the Medicare Local employment, nor at the moment any doctors on the board. The board is mainly consumers and business people. They have disengaged with the nurses. We had a very proactive nurse support person previously in my area, and I believe in all the areas because we had some great meetings, but now there's no engagement. There's an e-newsletter once a week, which I read heavily. They run a few courses, but nothing to engage the nurses. They don't come around. They don't, you can't talk to them on the phone. They don't like to speak with to coordinate anything is about 17, and she's just a reception girl. She writes her names down, says it go to 10 or something, but that's it. There's nothing with her nurses. And I was interested to see if it even joined, because I assumed that, well, certainly for the board, it was a co-opted membership. I didn't even know that you could actually ask to join Medicare Local.
Okay, so you've got something.
Maybe you can.
They are all different, but yeah.
Hi, my name's Pilar. I'm a medical with the Warashine Medical Local. I work very closely with Ross. I'm also a registered nurse, and one of the things that, as a nurse, and I hope you will agree, guys, is that even if you in the areas where you're unfortunate enough not to have that support from your Medicare Local, your nurses, what is stopping you from networking yourselves, which is wonderful, and ultimately that's what we're trying to achieve with our demonstration project that we'll be presenting later, is that we want you guys to self-facilitate, and we want you guys to get out there. We will help and support as much as we can as Medicare Locals, but as nurses, that's one of the things that we're the best at, which is networking and sharing. Sorry, I had to say that.
No, that's very good. And in fact, is that enough from your table? Is there any other burning things?
Sorry.
Okay, thank you.
I'm from Orange, New South Wales, which have the Medicare Local divisions is, I think it's Bathurst, and I tend to work. Orange is in the middle, very, very large geographical area, probably the largest area of health in Australia.
No, West Australia doesn't.
Oh, West
Yeah,
Australia.
that's right. Sorry.
But what I do find
Pretty
is,
close.
with the Medicare Locals, I have a different understanding of their role. I actually thought that they were not part of the division or a remaking of the division. I actually thought they were actually something very different. I work in a specialist practice. I have multiple different disciplines of specialties working within that practice. I am the only nurse within that practice. When I also get newsletters through the Medicare Local, but as the practice manager. So the practice does get these newsletters. In those newsletters, I do find that there's, it's mainly geared to GPs, or what GPs would need. I feel that, I think that nurses within specialist practices, although we are few, we do still need support within those areas. And as I said before, I didn't realise I was primary health. So there's a whole lot of things there that needs to be educated and so forth. And I just feel that the specialist practices and allied health, as in physios and so forth, do not get represented within our Medicare Local very well. And I believe that actually, I have contacted the Medicare Local in my area. I have said what I'm doing, which is building specialist services within our whole region. But what I'm noticing is that they have not come back to me and said, well, what about the audiologists? Because I'm in contact with audiologists in the area. I've actually been a network of the practice managers which have actually grabbed hold of the allied health. But anyways, just something.
Sorry, I am conscious that time is moving on and you will want to probably have a bit of lunch. Very quickly, this table.
We all have
individual conversations, I think, trying to, gather bits. But the important thing that you said in the beginning, James, is membership of MLs, which everybody's brought up. And I'm just really fortunate that we're individual organisation. We encourage med students, nursing students, ours is open now. Voting rights are very dependent on whether you're associated or not. But the thing that was interesting theme that kept coming up as well was the conflicting priorities within the Medicare Local themselves as well. So the people that are actually in there doing the work are working on this project, but now all of a sudden they've got to do this project and this one, and they're new into their positions and who supports them.
Yeah, I think we do have to acknowledge that Medicare Local is still in this table here. Is there anything you wish to add to the conversation? Yeah.
My name is Heather Wilson. I'm an independent nurse, practice nurse actually. By that I mean,
I'm an independent nurse practice nurse, and I work for 3 GPs who are ageing. Youngest is about 66, the eldest is 78. The clinical support office staff have been there for the minimum is about 5 years, but the majority are 20, 30 years. So I have a bit of a battle with change, and this has been totally enlightening to me. I was not even aware of Medicare Locals. The last I knew about was the Hunter Urban Division of Practice. I work in a small coal town called Kurri Kurri, and our community is ageing rapidly. One of the things we talked about, and we heard from one of our previous speakers, is the change in how we perceive medical care being given in the community. And I think it was called the National Health Reforms and the Power to Ascend. I'm forgetting who talked about it, but I don't see, from what I've heard about today, that that's actually happening in quite a few of the Medicare Locals, and that there are perhaps, in a few of them, there are people who don't have expertise in the patient care model, and they come from backgrounds where perhaps they are not totally informed in that area. And I think it's really important, we all agree that it's really important that people who work at that level do have a very good understanding of what the needs are in that community, rather than just being appointed in the old system of perhaps in New South Wales it used to be called the Department of Public Health, and it was filled with a whole lot of bureaucrats who really lived in their little white towers. So that would be my observation. I hope I haven't drawn my nuance twice.
Does this have anything to offer to the conversation? I'm sure you do. Be fair.
Oh, okay. So, about 2 weeks ago, I thought I'd throw in my nursing registration. Moved to a new place, didn't know any nurses, Medicare Locals not answering my emails, thought I was very isolated, but been given hope, although a bit frustrated that some people do get their emails answered, apparently. And happened to, and I don't believe in coincidences, but sit next to a nurse from the very remote area that I come from in South Australia, so now there's 2 of us. So we've already booked up our nurse network meeting, and I don't know how many other practice nurses there are in this small town, but anyway, we'll work it out. And we'll see what we can do. I suppose for me at the moment, just wondering about how much can I say to Medicare Locals, being the new kid on the block, without getting up their noses and saying, oh yeah, whippersnapper or whatever, go jump in a hole. I don't know. So that'll have to be worked through. I am disappointed though about the different standards and different roles that different Medicare Locals are providing in general practices. I think that a little bit more standardisation might be nice.
Unfortunately, that was not a government requirement. In fact, they are positively encouraging them to respond to their own population health needs, to have independent skills-based boards, which means that, there's not necessarily a huge understanding of clinical stuff on boards, as we just heard, where they have no clinician on the board. But that doesn't mean that you can't have a role. And I think the thing that came out of Tracy's talk was she said, does it have support? So if you want to make a change, you need to stand up, find that support, and then take it and steamroll, if you can. Now, there will be changes over time as this role of Medicare Local starts to settle in. At the moment, as you can see, there's quite a lot of disparity across all the Medicare Locals. There's not one person I could direct you to, but what I could do is I could direct you to APNA, where if you've got an issue, we'll listen to it and we may be able to help you solve some solutions. We may even be able to put you in contact with other APNA members in your area, and that could form the basis of a network that you can then grow and strengthen and take to the Medicare Local and hand it to them fully formed. Sometimes we have to start with ourselves. That's how APNA started. That's how in Western Australia we have the West Australian Primary Nurses, the Practice Nurse Association. Disgruntled nurses are very powerful people. So I encourage you to go out, become disgruntled, take your power and deliver yourselves to the Medicare Locals in your area. Thank you very much.